Hey everyone, it's Dr. Ida Khan. Welcome back to our channel Medico's Guide. Today we are going to be discussing about closed and open packed positions of joints. Have you ever wondered why certain positions feel more stable or comfortable than others in terms of applying manipulation on joints? Well, it all comes down to the mechanics of our joints. Let's explore. These are the objectives of our today's video. Basic concept, definitions, clinical significance or importance, and differences between closed and open packed positions of various joints in human body. First off, what exactly are closed and open packed positions? Simply put, these terms describe the extremes of joint positions in relation to their maximum stability and congruency. Now let's take a look at the definitions of each term. Open packed position is a position of joint rest and allows for more excellent range of motion and flexibility. While in contrast, the closed packed position is a position of maximum stability and is often used for weight bearing activities. Now let's take a look at clinical significance. Generally speaking, clinicians are aware that they should mobilize when in an open packed position and refrain from manipulating when in a closed packed position. What further clinical implications do the open versus closed packed situations have? Let's direct our attention towards open packed position first. Open packed position is ideal for joint evaluation and treatment initiation. It provides the greatest range of motion and mobility. It allows for easier assessment of the joint mobility and ligament stress testing. It is commonly preferred by the body after injury to facilitate fluid buildup and swelling reduction. It enables gradual progression of mobilization as range of motion, pain, and edema decrease. Let's talk about the clinical importance of these positions. Starting a joint evaluation and treatment in an open packed stance is crucial. Mobility is best tolerated in this position since the joint offers the greatest range of motion. For instance, the knee is in its open packed condition at 25 degrees of flexion. Full extension is the packed position. Knee is loose at 25 degrees of flexion. Checking tibial internal rotation, external rotation mobility, or evaluating varus and valgus ligament stress testing can be done in this position. Knee is unlocked biomechanically. The body prefers this position after injury because it allows fluid and swelling to build up inside the joint. The physician can begin mobilizing the joint in further flexion and extension positions as needed once the patient's range of motion, pain, and edema have decreased. It is crucial to fully understand both closed and open packed positions when performing manipulations. In order to manipulate a joint in open packed position, we frequently have to lock out or close pack the surrounding joints in order to target the particular joint. For instance, the hip must be positioned in extension, abduction, and internal rotation when executing a prone SI joint distraction maneuver. The hip joint is in its tightly packed posture in these three motions. When aiming at the SI joint, you have to lock out the hip to avoid manipulating it. Being able to rapidly memorize the open and closed packed position of each joint can help you become a more effective clinician. If not, your technique's specificity will drop. Now, let's delve into the differences between the two. In the closed packed position, ligaments and other supporting structures are taut, maximizing joint stability. On the other hand, in the open packed position, these structures are more relaxed, allowing for greater mobility but reduced stability. Now, in open packed position, it is a position with the least amount of joint surface congruency. Capsule and support ligaments are lax. Accessory motion or joint play is maximized. While in the closed packed position, it is a position with the most amount of joint congruency. Capsule and supporting ligaments maximally tight, accessory motion is minimized. Now, what do we mean by joint congruency? The closed packed position is where a joint is maximally congruent, meaning the articular surfaces are tightly compressed, providing maximum stability. This position often occurs at the end of joint's range of motion. Conversely, the open packed position is where a joint is slightly less congruent, allowing for some degree of movement. This position typically occurs in the mid range of motion and is less stable compared to the closed packed position. Now, let's apply this knowledge to various joints in the human body. Starting with the shoulder joint, the closed pec position occurs at maximum abduction and lateral rotation, providing stability during overhead activities like lifting weights. While the open pec position occurs at slight abduction and neutral rotation, providing flexibility for activities like reaching overhead or stretching. Moving down to elbow joint, the closed pec position is achieved at full extension and supination, ensuring stability during activities like pushing or lifting. While its open pec position is characterized by approximately 70 to 90 degrees of flexion, offering mobility for tasks such as bending or lifting objects. Now, let's take a look at wrist joint. The closed pec position occurs at full extension and radial deviation, offering stability for tasks requiring wrist support such as typing or gripping objects. On the other hand, in its open pec position, the wrist is slightly extended and in ulnar deviation, allowing for flexibility during movements like typing or playing musical instrument. Shifting to the hip joint, the closed pec position is reached at maximum extension, abduction, and medial rotation, providing stability for weight bearing activities like standing or walking. In contrast, the open pec position is reached at slight flexion, abduction, and external rotation, providing flexibility for the movements like squatting or sitting cross legged. Next, the knee joint. Its closed pec position is at full extension, ensuring stability during activities like running or jumping. Its open packed position occurs at approximately 25 degrees of flexion, allowing for flexibility during activities like walking or cycling. Finally, let's explore the ankle joint. The closed pec position occurs at maximum dorsiflexion, offering stability during activities like walking or climbing stairs. Whereas in its open packed position, the ankle is in a neutral stance with slight dorsiflexion, providing flexibility for movements like walking on uneven terrain or dancing. If you want to know these positions for other joints of the body as well, I have attached images for you. And there you have it. Understanding the concepts of closed and open packed positions can greatly enhance your knowledge of joint mechanics. Thanks for joining me today and stay tuned for more interesting insights into the medical field. Until next time, keep exploring.